Well, Dr. Piskin, sorry, we have talked a little bit about missing teeth and the type of problems they can cause. Headaches, shoulder pain, neck pain, ugly looking, and lots of other teeth, maybe because of it starting to be missing, because there's no support there, so they start wiggle-woggling, become ugly, start looking ugly. They shift, and a shifted tooth looks ugly. So we have that. Now, what are some of the main ways of replacing those teeth, and what has happened in terms of technology over the last, 5, 10, 20 years to make this better? Because we have heard that George Washington, apparently, not so sure, had a wooden tooth in it at one point. That must have been awfully uncomfortable, if it is true. Tell us about what exists there to replace missing teeth. What's the longevity? And what which method would fit better for which situation? Give us a little overview there, please.
Sure. We definitely don't use wood anymore, so that's
okay.
For sure.
That's good to know.
That's good to know. Well, the idea of implants being implemented into the dental world many years ago, and now pretty much on a regular basis, we replace teeth with implants if we can. We don't want to have to use other teeth to help support a bridge. The longevity of an implant to replace tooth is so much longer than a bridge. With bridges, patients sometimes they have difficulty cleaning around it where the false tooth is. The teeth around them sometimes aren't happy. They end up with new decay. They end up with bone loss because they can't clean them well around it. They break. So, you start having to replace these bridges a little bit more frequently, every 10 years if you can get them to last. But the implant replaced teeth, they last a long time, and they're easy to clean. So the cost over the long run is so much better to replace missing teeth where you don't have to do bridges. If that's a possibility, that's what we're trying to do today, much more than years ago.
I see. So what you're saying is when you do a bridge, which is basically taking you have two teeth and you have a missing tooth there. What you're saying is you grind the good teeth down so that you put a crown on it and hang another crown in between where the missing is, and because you grinded them down, or because that tooth is still subject to fail, it can get still a root canal and everything. It can start hurting, and because of that, and because of the fact that people don't clean that area so well because it's difficult to clean, the bridge sometimes fails more often than an implant. Is that what you're saying?
I would agree with that. If you don't have to touch healthy tooth structure, we only have one enamel on our teeth. Once we strip that off, and the tooth sometimes is not happy that we've drilled on it, and then they end up being painful. They need root canals. So, yes, if we don't have to touch those teeth to hold in as anchors to replace the missing tooth, sure, we would rather not do that. And that's where the idea of implants comes in. So when you weigh the cost factor, implants with a crown replacement on a single versus a bridge, it's about the same. Maybe the implant's a little longer, but in the long term, it's going to last so much longer, and it's so much easier to clean. You can use your regular toothbrush and floss with the bridge. It's much harder to clean around that bridge, and the teeth end up becoming decayed sometime because patients get so frustrated, so they don't clean it as well as they should. So the implant is economically a better choice to replace missing teeth today, for sure, both cost and longevity.
Yeah, the cleaning, if I would have to clean a crown and have to use one of those threads and because I'm basically a little bit lazy. I mean, I finished showering, shaving, washing. My wife is still brushing her first 3 teeth, I think. And so I would be one of those people who would be a little negligent in that area and would pay the price by maybe getting gum disease. And you have talked in other videos how devastating gum disease in itself is, never mind that you can lose the teeth about it again. Well, all right. So basically an implant, and the implant in itself, you said, more or less lasts, a lifetime, except if some funny eating habits or some freak accident happens. It more or less just, that metal in that bone doesn't get rejected. It sits there and it's stable and strong and sturdy.
Yeah, absolutely right. It is an amazing thing. Even when they say with knee replacements, it's only good for a certain time. We find that the implants in the jaw that we replace missing teeth, really, once they're in the jaw, they're staying there for the rest of your life. It's an amazing process and quite easy to do.
Well, wonderful. Thank you very much for shedding some light on
You're
this
welcome.
whole situation.
Nice seeing you today.
Bye-bye, Dr. Piskin.